Do you want to create a successful business and preserve your energy? Make more money while you stay true to your values? Know how to reclaim your calm in times of stress? Enjoy a balance between the time you give your career, your family, and yourself without feeling guilty? Welcome to the Reclaim Your Balance podcast. I'm Dr. Laura Schwent, longtime dentist and work-life balance coach. In each episode, we'll explore ways to feel empowered about the time you devote to your career, your family, and yourself. Develop tools to help you reclaim your calm in times of stress, and purposefully make more balanced daily decisions based on your core values. Join me as I hack the world of work-life balance and bring to you extraordinary professional women who are at the forefront of living their best lives in balance and harmony as guests to constantly inspire you to reclaim your balance. You are the CEO of your life. Now become the boss of your balance. All right, everyone, happy Friday. If it's Friday in your part of the world, it may be a little later or earlier, but we are here with Dr. Mona Patel from Patel Distinctive Dentistry. And welcome, Dr. Patel. I'm so excited with you this morning about all that you do. So
thank you.
Yes.
So I'm so happy to be here.
Fantastic. The reason that I originally reached out to Dr. Patel was because she is an advocate of dental sleep medicine and really helping her patients, her family, even herself down the road of good sleep and how foundational that is to our health. And I think this is just such an exciting part of dentistry right now that we can help patients with their sleep. And so you just started this like 2018, right? Is that when you first got into really being serious about sleep dentistry?
Absolutely. Like I had heard about, sleep dentistry, since 2015. I wanted to kind of learn more about it, but it really wasn't on my radar. And then, with chance and luck, I was connected to someone who was teaching it, and spending some time with them just opened up a whole new world for me and my team. And now, friends, family, patients, we are just helping people live better lives, longer lives. Yeah. It's amazing. But a lot of it, I put two and two together for myself. So
I'd love to hear your story, because you have personal experience with this.
I do. And, as a woman, right, I was feeling very tired, maybe 7-8 years ago. I just was feeling so fatigued. I'd come home from work and seeing patients and feel so guilty because all I wanted to do was lie on the sofa and not make dinner or get snacks for my younger children. And I just thought I was getting old, and then, I went to the doctors. I was diagnosed with hypothyroidism. So I was put on, Synthroid to help my thyroid, to, help my energy levels. But as time went by, I needed more and more medication. My dosage kept going up. And then I was put on metformin for prediabetes. And then progesterone, and then vitamin D deficient, and then a whole load of supplements to support all of that, right? So, and I'm thinking I eat clean most of the time. I'm working out, but I feel so tired and I feel so fatigued. And I'm also really irritable. I'm just snappy, which, and my mom lives in England, so I talk to her every day. And she's like, you're really not yourself. And I'm like, no, Mom, I'm just, there's so much going on, right? So I really thought it was age just slowing me down, and that I was one of the unlucky ones to have all these issues medically.
Mm.
And then, you know, went to this sleep course by Sleep Group Solutions. And they, you know, when you go to a sleep course, it's really interesting. They have a lot of home sleep tests so that you can try it out to see what it's like. So I tried it out. And I have mild sleep apnea. So I wake up, or I used to wake up, 11 times an hour with either full-on blockage or partial blockage, right, of my airway. So 11 times an hour. So that's almost like every 6 minutes. Every time I tried to sleep, it would be like someone shaking me to kind of like wake me up. So I never got my full rest. And I treated myself. I made myself an appliance. And in fact, I made myself about 7 appliances because I wanted to try each and every one out.
Mm-hmm.
And now my events are less than 3, which is meaning that I sleep well. But I know that I sleep well because I wake up before my alarm. I wake up and I'm not tired. Like I'm ready to go. My energy levels are different. I don't sit on the couch, and I'm off the metformin, and my dose for my thyroid went down. But what I realized is that as I started to learn more about sleep dental medicine, how the root cause of everything is to do with sleep. Even at that time, I had terrible TMD. I was having a huge problem on my left joint and had so much muscle discomfort. And I know how to make TMD appliances. That's, you know, I'm trained on that. I teach for a clinical mastery series that also teach TMD, and I couldn't get myself comfortable. The minute I put my sleep appliance in, 2 days later, my TMD reduced. Like maybe I had 10%, and now, you know, a year and a half later, nothing. Yeah.
That's amazing.
Yeah. So when I made those connections, I'm like, whoa, this is something that here I am at my office seeing people with TMD issues and telling them that they grind at nighttime and making them appliances, but in actuality, am I making them the right appliance?
Mm-hmm.
So that got me thinking, yeah.
Mm-hmm. Well, and it's true. I think there's those patients that you make an appliance for and they don't seem to improve. And everything we've been taught, you know, just like you with yours. And you think, why? And there's something, like you say, a bigger root cause going on.
Right. And it took time for me to wrap my head around it. And, you know, but once I did, I don't make an appliance now without doing a home sleep test for my patients. Mm-hmm. And I told them, I say, like, I want to make you an appliance because we've just, you know, fixed your smile, or we see signs of, you know, wear, and we want to protect the enamel on your teeth, or you have muscle dysfunction, or you have a joint issue that we're picking up on the exam. So I really need to make you the right appliance, but I don't have enough information. And I need to know what you're doing at nighttime. Mm-hmm. And that really helps to get patients into the right appliance. Mm-hmm. And now we welcome, like I mean, I've been at my practice for 25 years. So I've made night guards for patients who have hated them. Mm-hmm. And it's always like, well, you know, you've got to wear it. You know, why aren't you wearing it? Let me help you. You know, now my hygienist knows to definitely ask or bring to my attention patients who are really struggling with their night guards, because those are the patients who may have a sleep issue. Mm-hmm. Yeah.
So even your past patients you can bring into this realm and treat differently.
Yeah. Even the patients in your operatories, like anyone who's, you know, we all have those patients like with the big tongues and the big teeth, right? And you take them back and you can't get to those teeth because that tongue keeps fighting you. Or laying them back, they have a hard time breathing. And you don't realize it. And you just like, you know, it's so easy. I remember in my younger days rolling my eyes and going, it's a difficult patient. Oh my God. Like, but in actuality, that's a person that needs your help the most.
Oh.
Got to get, so my assistants know patients like that, sit them up, talk to them, ask them the screening questions, and let's get them on the road to finding out what's going on.
Oh, how rewarding is that? That's awesome. All right. I want to talk more about this, but I want to go into your background and what got you into dentistry. You started dentistry, dental school at a very young age, 17. Is that right?
17, yes. So I grew up in England. I was born in Africa. And my dad was actually studying for pediatric medicine in England. And mom and I had to flee in the middle of the night because Idi Amin, we stayed right till the end, apparently, thinking that it would turn around, and it didn't. And, we left middle of the night, left everything there, and joined my dad in England. And I was 3. I mean, I don't remember much of it. Mm-hmm. So I grew up and, went to school, but, I skipped a couple of years, so I was super young. And in England, you can go to, you choose your career very early. So you go to dental school, medical school at the age of 18. I went 17. And at that time, it was a 4-year course. So I graduated at 21.
Wow.
And I didn't know anything. I mean, I couldn't even, I would go in to talk to my patient. I'd be like, hello, Mr. Smith, how are you? At 21, what do you know?
Right.
But there I was, at 21. Dentist.
That is a phenomenal story. And then you came to the States and you essentially had to train again, didn't you?
Yeah. So I'm, in Indian culture, you grow up, you go to college, and after college, it's time to get married to a suitable boy. So I finished college, and mom and dad, even though they were super educated and super modern for their time, okay, Mona, it's time to find you a boy. So they started sending, out feelers, and, they had me interview 12 boys. And one of them was actually living in America, and we hit it off. And so I ended up, and he ended up saying yes to me, and I was his 13th, and he was my 12th person. So we got married, and I'm here. And then I had to requalify. I went to University of Pennsylvania, and they have a 2-year foreign dental program. So went there. I taught a little bit there as a clinical instructor. And then as soon as I graduated, I think 3 months later, I found this amazing position at this practice. And I've been there 25 years. I bought it maybe 3 years after I started.
Oh my gosh. Yeah. That's awesome. That's a phenomenal story. Wow. And you've been just a big proponent of continuing education. What was your driving force for that? Why is that so important to you?
Well, as you start practicing, the longer you're in the practice, you start to see patients that you really care about continue to break down. Even though you've taken care of the inflammation, taking care of the caries, there's still breakdown. And I realized that they're going to need me to be so skilled at certain things. And that's diagnosis, that's joint diagnosis, muscle diagnosis, occlusal diagnosis, and putting all of that together to give patients a good framework to make the decisions for themselves, right? So it's not like you're saying to a patient, okay, you need a full mouth rehab. But at least you can tell them that these are the consequences. This is what I see. You can show them photos of patients of yours that are in the same situation that have progressively gotten worse. And then if they decide that they want to move to the next step, you then have the skills to do that, right? So continuing education for me is really important, because how do you learn those skills? The days of when I first joined my practice, the doctor there, Dr. Such, male dentist, they had a network of an old boys club, and it was a good network, right? Mm-hmm. But now, where do we go? Where do we go for mentorship? So, and how do you learn? You've got to learn, number one, the theory, right, behind everything, but then you want to learn the logistics of actually how to do. So it's like you have to like balance both. So I mean, I started off with the dentist who I bought the practice from. He was really my mentor, and he was Pankey trained, so I had a lot of Pankey influence from him. Then I did, Bill Strutt's Crown and Bridge curriculum, which is back then. I mean, he was one of the first ones doing that. Then I did a Spear. I did the whole Spear curriculum, their workshops, and then I did Clinical Mastery Series, and I was invited to be on their faculty. And then I did the sleep and was invited to be on their faculty. So
that's fantastic. That's a great journey, and I love that. Just putting it to your patients. I mean, that's ultimately what it comes down to, is being able to have all the pieces and know that there is still more to learn. That there's, I mean, it evolves every day, right?
Yeah, there's so much happening in dentistry. I mean, this is a really good time to be in dentistry. It's amazing. It's just trying to not have overwhelm about not knowing everything and trying to do everything at once. And I started in 2012. And the one piece of advice I would give anyone is enjoy the journey and don't be in a rush to get there. Like, really take that time. Don't implement everything too quickly. Just kind of do it at a steady rate, because then you'll bring your team along the way you're growing. But if you hit your team with everything, it can create stresses in your practice, and you can lose some good team members because of that.
Right.
I mean, and ask me how I know.
Yeah. Well, yeah, right. Experience tells you that. And when you wanted to bring sleep dentistry into your practice, tell a little bit how you did that, how you started that journey with your team.
I did that a little differently because I learned my lessons. And, because 3 years ago, going through like a whole transition in my practice where I was starting to do a lot of complex dentistry, I had taken all my team on these great courses, but it created some overwhelm. And then I had some maternity leaves and lost a couple of good team members, and then trying to onboard other people was so stressful. So when I was ready to introduce sleep into my practice, I was really lucky enough to have one of the great educators for Sleep Group Solutions. Her name's Rebecca Leahy. She actually came to my office and she gave my team a boot camp. We just spent the whole day, we blocked out the whole day, and she went through everything about sleep. What are the consequences? What are the signs? What are the symptoms? What can it lead to? How it affects kids, how it affects women and men, and what can we do about it? And as we're going through it, I'm like thinking, oh, this patient has that. And I start writing names. And my team start looking at me and they're going, what are you doing? I'm like, these are the people I think might have it or have an issue. And they're like, oh my God, doc, you're right. And then each and every one of them is like, I think I have this issue or I have this issue. So we just started to talk about it. And at the end of the day, I just looked at them and I said, hey, I want to change the practice a little bit, and I want to save lives. I don't want to save teeth. I want to save lives. Are you guys on board? Because I can't do this myself. I really want to do this, but I won't embark on it if I don't have your full support. And each and every one of them were like, no, we're on board. We're on board. And then to really reinforce it, I got my whole team tested. I got their spouses, if they had issues, tested. And the ones that needed treatment, we got into appliances if that was appropriate for them. So that just made the biggest difference.
Yeah, that's great, because then they see the real life adaptation of it. And that's, I mean, for them to have that personal experience and then be able to talk with patients about their own personal experience.
Huge. It's huge. Yeah, huge. Like my hygienist is a young hygienist, but she had TMD. And, I had done centric related, bite with mounted models and equilibration, and I was going to she was scheduled to do that, and then I was going to make her an anterior discluder slider type of night guard. And we tested her, but she had upper airway resistance syndrome. So it just totally changed my game plan on her. And for her to be able to speak that with patients is huge.
Mm-hmm. Yes.
Yeah.
Wow. All right. So if you were a new dentist starting out, or maybe a dentist that hasn't done any sleep dentistry, even ventured into this, but you're interested and you want to, what would be your suggestions to start, dipping your feet in the water of this?
I think that there's just so many good courses out there, to be honest, for sleep apnea. Mm-hmm. Now, I teach for Sleep Group Solutions, and they have a great 2-day course on it. And now, because of the COVID, it's difficult to want to go to a course because of traveling and stuff. We actually filmed some great online modules. Oh, so cool. Yeah, so the modules will take you through the whole 2-day course.
Nice.
Yeah, so that's really fantastic. So Sleep Group Solutions course is really nice because it gives you a big overview of everything. It shows you how to screen patients, how to talk to patients about it, identify dental oral signs, how to talk to physicians, how to implement a home sleep test in your office, and treatment, and also billing, medical billing part of it too. Mm-hmm. The other people that have great courses like that is Erin Elliott with 3D Dentists. She does a 2-day basic course. There's also Meghna Dasani, who does a great course on sleep apnea. I was lucky enough to spend 2 days with Steve Costenston, who teaches for Pankey. I'm part of a Pankey study club, and every year we bring in 2 really great speakers, and there's like 13 of us. So I got 2 days of Steve Costenston. So Pankey has a great sleep course. But what I would do is I would do a couple of foundational sleep courses. Mm-hmm. So they're usually about 2 days each. And it gives you a nice overview of it. And it gives you a way to maybe implement it into your office. Mm-hmm. And once you get started, I would definitely advise to do more. There's going to be so many questions that you need to have answered that the foundational courses won't give you. Mm-hmm. So I did a sleep residency with Nearman Practice Management, and Mayor Patel teaches it. Uh-huh. And the reason that I did the sleep residency is because treatment of sleep issues, it's not just sleep. In fact, it's part of a bigger picture. That's pain and TMD. So a lot of your sleep patients already have pre-existing TMD issues that you need to be aware of. So any kind of course that involves that is always good to know, because you need to diagnose the health of the joint and know where you're at with that before you make your sleep appliance. So you know what to inform the patient, how to control the treatment, the positions, etc. So,
yeah, because if you're putting them in an appliance, that's obviously going to affect their joint, and so knowing all of that really is necessary.
Yeah. So, like for example, when patients are clicking and then they stop clicking, you would assume that the disc is now off, right? Mm-hmm. And patients think, oh, I was clicking and now I'm not, so everything's fine. Mm-hmm. When in reality, it's not.
Right.
Then you make them a sleep appliance. And sometimes with that, because now they're not activating that reflex to brux at nighttime, mm-hmm. right? There's less stress on the jaw joints. So maybe they start clicking again because the joints, maybe the disc is starting to recapture a little bit. Uh-huh. So suddenly you've made them a sleep appliance and they stop clicking. So they think that something's wrong.
Right.
So if you know that ahead of time and prepare them for it, it's so much better than having that conversation later on.
Mm-hmm. That's awesome. I would think too that finding a good mentor in this, even in your area, so that when you're getting started, maybe you can recognize the signs and refer patients as you're getting your,
Absolutely.
And then as you're building your education around it, then you can start treating your own patients. But what a great connection.
Yeah. And that's how I actually, I had all the theory in my head, and I really wanted to see how it visually flowed with patients. So 2 people gave me such a great experience. I went to a Dr. John Carollo in New Jersey, and I spent the whole day with him as he did, first appointments, records appointments, deliveries, and follow-ups. And then I went to Dr. Ryan Robinson down in Delaware, who has a pain and sleep clinic there. So I definitely recommend mentorship for sure. And, anybody who wants to come in and watch what we do, I'm happy to have them. But that's, I think, the best way to learn.
That's awesome. And speaking of mentorship, this is something I just loved reading about you. You started your own all-women's study group called the Dynamic Dental Divas. Tell me how that was birthed. How did that start?
So it was very funny because I've been going to a lot of the local study clubs, but I wasn't feeling it. The content was not pertaining to me at that time. And I just saw less and less women. And it was, you feel kind of like, where are your sisters? Like, what's going on? Like, we have different challenges as women in dentistry, right? Because when we leave the office, we go in and you're a wife, you're a mother, and sometimes you're like a daughter-in-law if you have your in-laws living with you. You're a housekeeper. You're the person who takes your kids to this and that and everything. And how do you deal with that on a day-to-day basis? And so I wanted that sisterhood with women dentists in my area. And actually my Patterson rep, Jerry, kept, coming into my office, and she's like, you've got it together. This office is like, it runs like clockwork every time I'm in it. I'm like, thank you. She's like, we should really get the women together. Like, there's another doctor who's just like you, and we should just get together and form a club. And that's what we did. Yeah. So
how awesome.
Yeah. And from that, we just created like ways to, we refer to each other, or, my most favorite meeting, everyone loves, is the round table, where I say, bring in cases. Bring in cases that you're stuck on, or you don't know what the next step is. We've got all the specialists here, and we'll go one turn by turn, and let's treatment plan your case and give you a few options, and you'll be unstuck. So, it's really good to do.
What a phenomenal resource for the women in your area. And I'm sure they love it. Absolutely love it.
Yeah. I mean, we've had some great courses, and even through, the lockdown for COVID, like we did, I did a really great course on transitions, on, selling practices and stuff like that. Because I actually recently sold mine 6 months ago.
Oh my goodness. Congratulations.
Yeah, thank you. Yeah. I went through a lot of thought process last year, and I realized that I'm really passionate about clinical care. And I wanted to pursue more of my education in sleep dentistry. And I knew that I just felt at this time, I didn't want to be an owner anymore. And doing a program that I talked to you about, Fern White's program, I really we got a lot of time.
That's amazing. So, okay, that's a perfect segue. Tell us how you got into Fern White, what that was about, and how that has helped you with work-life balance.
Yeah. How much time do you have?
I know, right?
Yeah. It's really interesting. When you check off everything on your list that you've achieved, right? You achieve that practice, you achieve that team, you achieve putting in all these things. And at that time, like, I was thinking, wow, I should be enjoying all of this. And I really feel disconnected from myself. I feel very empty. Like I've achieved everything, but I'd gotten to this place where I had to be perfect for everyone, and felt very disconnected to myself. And I read about Fern's program. It was on Facebook. It was just one of those things that came up. And it was about how to connect back with yourself, right? I had no clarity at that time. I didn't know what I liked. I don't even know what I like to eat, because I knew what my husband and my children like to eat, but I didn't know what I like to do even. I know my kids, on Saturdays will like this, so we'll do this. And I know my husband likes this, so we'll do that. But I had no idea. And on the outside, I looked like I had such a perfect life, right? Perfect everything. But I just wasn't feeling happy. I felt like nothing. So I did this program, and then it's called PYP. And it talks about how you can use tools to be able to reconnect with yourself, right? And one of her sayings is, stress makes you stupid. And stress, and you don't want to feel stress. So you kind of tamp down on the feelings you have so that you don't feel. So does that make sense? And,
Totally.
So I had just stopped feeling. That's why, because I didn't want to feel anxiety about my practice, or I didn't want to feel, anxious about this team member going on maternity leave, or what that patient was going to say because they weren't, happy with something. To deal with that stress, I tried to box it. But when you box your feelings, you can't just box that part, you box everything. So what happened was, doing this program, it kind of helps you empty all of that, face your fears. I mean, during that program, I started to understand that I am an anxious person, and I was feeling that anxiety. Then I learned how to sit with it and accept it as part of myself, and then have tools to help me through those times. And that's what the program is about. It talks about meditation, and I meditate twice a day to give me clarity. So my reactions now are not a reactive. They're not coming from a place of fear. They're not coming from a place of anger or frustration. They're just coming from a place of total awareness, and that's made a huge difference in my life. But I just feel so happy that I live day to day in the moment.
That's fantastic. And I think that this is so true for so many women, are the nurturers, the caretakers. So we're always putting others first. And there sometimes isn't even time to feel our feelings.
Correct. We're so busy. And then we tell ourselves a story that we're so busy to do anything for ourselves. We're too busy to look after ourselves. So we really push ourselves down. And I think also women have, I feel, especially women who are owning their businesses, they don't let themselves ask for help. They don't let themselves feel, it's a persona you project, that you have to do this and you've got to get it right, and you've got to know everything. And the biggest thing for me was decision fatigue. It's like you come into work, you wake up, right? And, right? It's huge. It's huge. I mean, how many decisions as a mom do you make before you get into work, right?
Right.
And then you get into work, and how many decisions do you make? And how many of those decisions are actually well thought out? They're all on the fly, because some team member comes up to you and asks you a question on the fly. Right. And you totally feel like you have to answer it. You totally feel like you've got to step in and rescue them and give them the solution. So again, this last year and a half, being able to say to a team member, I don't know the answer to that right now. How important is it to you? Is it urgent? No. Let's table it, and I need more information. Let's talk at the end of the day in our evening huddle. Okay, doc. Great. I don't have to make that decision right there and then. And then simplifying my life. like in the mornings, all of those things, just making it simple and easy. I don't go on my phone straight away in the morning. Like, yeah, I don't check email first thing in the morning, because just, you got to make a decision when you read an email.
Right.
Yeah. I do. Yeah. I don't worry about what I have to wear to work. I simplified that, so I don't have to, figure that out. Stuff like that. What's the food I'm taking to work? All simplified, no decisions. I get into the car, drive to work, not feeling like I'm overloaded. And then just changing the way I communicate with my team definitely gave me a new lease of life at work.
That's awesome.
Yeah.
Do you talk about this in your women's study group too? Is this a big topic among you guys?
It's a topic that I want to share with my members. I haven't done it yet. I'm waiting for a time that we can meet personally. I don't want to do it on a Zoom meeting. And I want to talk them through the journey, because again, we as women, I know that I was guilty of this. I identified who I am with owning my practice, right? So I am Mona Patel, and I own a dental practice, and I've been there for 25 years, and I'm fee for service, and I do this and this and this. And working through it with Fern's program, I realized that my identity is not being the owner of the practice. It's being me and the knowledge and the skill I have to bring to the people that I can help. And that helped me understand that I just didn't want to be an owner anymore. After 25 years, I wanted to concentrate on the clinical part of the dentistry and not be the business person. So I sold my practice, and I sold it to a great group. They are family based, and they own about 25 practices in the area. And I get to practice in my practice as an associate, but when the patient leaves and I'm caught up with my notes and my lab scripts and my referrals, I walk out that door and I'm done.
Yeah. So, yeah. And I just congratulate you on that, because that's a big decision, and you really have to. It really has to come from a place of knowing yourself to make that decision.
Right. And I didn't know. Like, I started Fern's program thinking I want to take my practice and my team to the next level. So I wanted to step into being, a better leader, and I wanted to grow my practice, and I wanted to be this for my team. And through the whole process, I realized, no, that's not what I want right now. Yeah.
I love that. Congratulations. That's phenomenal. All right, we need to wrap it up, but I want to talk about something really fun, and that is your love of crystals.
Oh my God.
And how you use them.
Okay. So as I'm talking to you guys, look.
I'm going to hide this so we can see.
I have my crystals. In fact, I've got a ton of them. There you go.
God, isn't that something?
Yeah. So I actually, I'm actually a very spiritual person, and it's funnily enough, I've always had fascinations for crystals, and crystals came into my life. I didn't go out to get them, but they came into my life. And you know what? There's certain properties associated with crystals to help. So like this is black tourmaline, and that helps, to ground you, or if you're feeling a little nervous or anxious, that's the one I hold on to. Blue crystals like sodalite and kyanite. So this is sodalite. That helps you get a good night's sleep. But what they do is, the way they help you is you can draw on their energy. Not everyone feels the energy of crystals, but if you're drawn to them or they come into your life, they're a really great tool to help meditate and just take some time out to ground yourself, because I think grounding is huge. And you can do that by going outside in nature, putting your feet in the grass. And I do that every morning while I'm having my cup of tea, and I'll take a crystal with me, and I'll carry, for what I want to manifest or I intend for that day, I'll choose that crystal. So yeah.
Awesome.
Yeah. I know.
And they're so beautiful too. On top of their benefits, they're beautiful.
They're beautiful.
You can get jewelry.
Oh, I have jewelry. I have crystals in my office that they help change the vibration or the energy of the place, right? So you can choose crystals to keep in your office that help to soothe, the energy, so that when patients come in, there's like a good vibe. Like, you go into some places, like you go into some places and you're like, wow, this is such a great Zen place, right? And you notice that they'll have crystals or they'll have a certain smell going. And that just helps to kind of calm things down.
Yes. So if someone's curious about crystals, what would be the first step for them, do you think?
The first step I would say is to find a crystal shop near you. Because that's the real best way to go in and find crystals, is to go into a place where there's plenty. And you know what? You'll feel drawn to a certain crystal or a few, and just pick them up. And you're always I always hold with my left hand. It's my intention hand. So I always pick up a crystal, and I feel like energy. And if you do, that crystal is for you. And then you can do that. There's amazing, there's so many crystal books out there. There's great, and there's great, I follow Sage Goddess. She has a ton of great content for crystals and how you can, help with sleep, with anxiety. You can get crystals to help your energy levels through your chakras, like the lining up your chakra energy and stuff like that. So yeah. Now you're all going to think I'm so woohoo.
Oh, no, this is great. I mean, because it's, dentistry is not just teeth. And we are learning more and more about how it is the whole body. And we also know that there's more to life than the whole body. There's the spirit and the soul. And so I love, you've really encompassed all of that in this interview.
Yeah, I do. I mean, I have crystals in my ops. Not anymore, nothing's out anymore, but I used to have them. What I really like to do with my patients, and I haven't done this yet, but I really want to learn about it, is Reiki. But I always touch my patients, and I always do a breathing exercise with them. And it's really great. I use it on myself too when I'm feeling anxious, and nobody knows, but it's just a very simple way of breathing. And when you do it this way, it helps activate your vagus nerve, which is, the parasympathetic system that helps you kind of chill and de-stress, if you're in that mode. But it's, I call it 3-3-6 or 4-4-8 breathing. And all you do is you breathe in for a count of 3 or 4, whichever feels comfortable. And then you hold for 3 or 4, and then you exhale for 6 or 8. So, it's 3-3-6. And your exhale should always be longer than your inhale. And that really activates that vagus nerve to help kind of calm things down and kind of get feeling grounded again. So
do that with each and every patient when you sit down?
I do. I always end up I always have my hand on the shoulder, and I'm like, okay, we're gonna get started, but before I go ahead and get you numbed up, let's do some breathing just so that you're feeling comfortable. And honestly, even the guys like it. Nobody said no or that's weird. They all do it because it's hard when they walk into your office and they sit down in your dental chair. They're giving you control. That's difficult for people. You've got to make them feel that you're working with them and for them. And, that's always how I wanted to practice. So, yeah.
That is beautiful advice. Something so simple to do that really bonds you and makes that connection with that patient as well.
And actually, before COVID, we were all used to like going for a hygiene check and then numbing in room 1 and then going to room 2. And so how do you stay grounded and calm as well? Right?
Mm-hmm.
So you're teaching the patient to breathe, and then you're breathing with them, and suddenly you just feel better too.
Mm-hmm.
Like you're now right there for that patient.
Mm-hmm.
You're not in your hygiene check patient. You know what I'm saying? Like,
yep.
Yeah.
Yes. Oh,
Yeah.
I love that. Well, that is a wonderful way to kind of segue into my very last question. And that is one I ask everybody. And that is, if you could give your younger self one piece of advice now from this point in your life, what would it be?
Let go of the outcome. Surrender. Yeah. Let go of the outcome. Whatever is going to happen, it's going to happen. And the more we try and control the outcome, the harder we make it for it to happen.
Mm-hmm. That's beautiful. Awesome. All right. Well, where can people find you if they want to take the foundational sleep course from us?
Oh, sure. So
Just how can we find you?
I could give you an email. monadmd@yahoo.com.
Okay.
And you can find me, you can message me on Facebook. I always get asked questions from people I don't know, and I'm happy to mentor them. So I do just, anyone who reaches out to me, I tend to just, help direct them in the right way. So you can reach me through there. You can, go on my website, just type in Mona and Patel. You can contact me through that website. So yeah.
Perfect. I will make sure all those links are in the comments below so people know how to find you.
Great.
Fantastic. Thank you so much for your time today, Mona. This is just absolutely perfect. I'm so excited to put this information to women.
Thank you. Right.
You bet. Have a great weekend.
You too.
Cheers,
bye.
Everyone. Bye.
You are the CEO of your life. Now become the boss of your balance.